Hello, can you see us? Can you hear us? Please give us a thumbs up. Hello. Okay, thank you, Comfort. Thank you all so much for coming. Yes, as you can see, it's very different today. I'm flanked by two very great friends and accomplished people in research. It's going to be an exciting time. This is the ABBY IMANI REVEALS Show. This is where we speak, we are real so that we can live and not just live any life, but the life that Christ has given us. Please let me know if we are loud enough, a bit far from the. I want to be sure that you can really hear us.
A bit low.
It's a bit low. Okay. Is it better?
Probably have to project.
We'll try and speak a bit louder. Is it better now?
I think it's not so bad, yeah.
Okay. Thank you, Comfort. So we'll pray. I would ask my fellow PK, pastor's kid, to pray with us.
Okay. So a loud voice. All right. So, Father God, we thank you for this day. We thank you for this opportunity to join, to discuss, to learn from each other. Pray that you open our hearts and our minds to this conversation, Lord. May we lead with what you want us to lead with. Thank you again for this gathering, and we lift up your name always. In the mighty name of Jesus Christ, we pray. Amen.
Amen. Thank you so much. So today we are talking about anxiety disorders, and I want to read this exact topic. It says that, do I need to get screened for anxiety disorder, especially in these times? I mean, when I say these times, we all know with the economic hardship and all the uncertainty around us, we're not sure, how we're going to manage, and sometimes situations like this can affect us, and we might or might not be aware of its effect on our lives. We might be behaving strangely, and we're not sure why we are behaving the way we do. So today we are going to get some answers and guidance to navigate this life and be able to better handle the challenges that we encounter. But before we proceed, I want to remind us, if you haven't subscribed, please go to the YouTube and share it as well as you subscribe, share with others so that they can join us and also learn from the various topics that we discuss each Monday. Thank you so much. So yes, we have to my left, Professor Olugbenga Odegebge. He's the founding director of the Institute of Excellence in Health Equity at the New York City Langone Health. And Dr. Aifah Goné.
That's right.
I got it right. She's assistant professor at New York University as well. I want to welcome both of you. Thank you so much. They are so busy, and I know Angie is sitting on hot coals right now, but she obliged and decided to join me. Benga is also very busy, so I really appreciate they coming to speak to us on the show today. So I'll start with Benga. So please speak a bit about yourself, what you do, and then we'll continue.
Thanks for having me. Abigail, it's always a pleasure to do this, and glad all the participants can join us today. So most of my work I do is focused on building evidence for how we treat people, particularly around preventive medicine. So I'm an internal medicine doctor. We call them physician specialists here, I think. But I also sit on several committees. I do a lot of research. I come actually to Ghana with some of my colleagues to build research capacity in how we manage what we call non-communicable diseases. That is anything that is not infectious disease. In this case, we're looking at work around cardiovascular disease, hypertension, diabetes, stroke, kidney disease, what have you. So the reason I'm here is to talk about an important program that I've been part of for the past 3.5 years. The United States Preventive Services Task Force is a panel of about 16 experts in evidence-based medicine. In other words, people who understand how to review the evidence as it relates to particular diseases, or really preventive services. And they issue guidelines every so often to think about how, we can screen people for particularly preventive services. And is that screening beneficial or is it harmful? So the one I'm talking about today is anxiety.
Yeah.
Anxiety disorder.
Thank you very much. Angie?
My turn? Okay.
Yeah.
So I'm Angela Aifah Goné again, and I'm an assistant professor at NYU Grossman. I'm a social work trained researcher, and a lot of the work that I do with Dr. Odegebge is focused on hypertension and HIV integration. So we do work in Nigeria, have some other projects in Uganda, and even in the States as well. A lot of the contributions that I want to offer to the table today for discussion is really based on my social work training and thinking about how best within our Ghanaian culture, I am from Ghana, how best can we start thinking about what these guidelines are telling us, especially given our cultural background, religion, and what have you. So that's why I'm here today.
Okay, thank you so much. So yes, we're here to talk about anxiety disorder, and I want you to relax, don't be anxious.
Indeed.
So again, I'll start with Wenga. Yeah, so you talked about the work you've done with the United States Preventive Services Task Force. Yes, it's better to prevent something, and avoid the adverse effects than to, and avoid the adverse effects. So tell us, what are the things we need to know about these guidelines and how can we apply to our settings?
Good, thank you. So about 2 weeks ago, I think probably the end of June, thereabouts, we actually released a guideline around anxiety disorder, depression, and suicide. And the question was for the guideline committee, if we screen people in a primary care practice who do not have recognized symptoms or signs of anxiety disorder, is it beneficial or is it harmful? And what the evidence shows is that if you screen people, adults 19 years and older, between the ages of 19 and 65, then the evidence is very clear that people without symptoms or signs of anxiety disorder, if you screen them, that screening is beneficial in terms of it's leading to preventing adverse effects of anxiety disorder.
Right. Do you have anything to add?
No, I mean, I think you captured it.
Okay, so what are some of the details of these guidelines? And how can we, I know it's tailored to the society in the States, so how can we apply it to Ghana and Africa for that matter?
So that's a very good question. So basically, Abigail, think about it. Anxiety disorder is actually a mental health disorder. And as you know, particularly, we just came off of the COVID pandemic. People, didn't have jobs. People who have jobs lost their jobs. People's kids didn't go to school. And people were worried. A lot of people were dying from the disease. So that in itself has increased the burden of anxiety in the entire population, regardless of where you are in the world, right? So because of that, there's a renewed attention, and the task force cares deeply about the health of populations, particularly as well as mental health. So typically what would happen is to identify the symptoms, to diagnose anxiety disorder, it's important to understand what is it.
Yeah.
Right? I think we should start with what is it. And then I'll talk about how it affects the context in Ghana. Basically, you said it a while ago about losing jobs and all that. Everybody worries. It's okay to worry. I have 3 kids. I worry about them all the time. Teenagers and adults. We all worry, right? I have a job that's, it's stressful. It causes me some anxiety sometimes. That's normal. If you lose a job, that's okay. That's also okay. There are things that make people worry. You have a divorce, just have a child, you're pregnant, you're worried about your child. You just got a new job, you're worried about your new job. You just got married, are you going to care for your wife and your children? it's normal to worry.
Or
Kid
how
just
even
changed
care
the
for your
school.
husband.
Are you going to care for your husband?
That's
That's so. All of those things you worry. Anxiety disorder though, is excessive worriness. When you worry all the time, and when you worry to the extent where it begins to actually take over your normal activity, where you worry to the extent where you no longer can function the way you normally would function. That is what we mean by anxiety disorder. Now, how do we screen for it? Typically, you ask people questions about symptoms and signs of anxiety disorder. And you use a questionnaire, we call that a tool, for people to respond to. And if they respond to those questionnaires, they have certain scores. Above a particular score, you say they screen positive. So once you do that, what that means is that that person's risk of developing anxiety disorder or of having it is high. You must then confirm that diagnosis. That's very important. So the fact that we screen you with a question doesn't mean you have anxiety disorder.
Okay.
Because you can screen positive and you can screen negative. It can be false positive or false negative. And which means even though you screen positive, you may not have the disease. But for the most part, what we found was that in people 19 years and older, less than 65 years of age, the tools are pretty much accurate.
Mm-hmm.
And then you make a diagnosis. And then once you do that, you then must connect people to care for them to receive the care. I'm sure we're going to talk about that in a second. Now, all of those trainings in English language, in a culture that's totally different from our own culture here. So if I have somebody in a primary care practice, I'm an internist, and I see them in practice, I would want to know about anxiety disorder. But it turns out, in our setting here, the stigma around anxiety or any mental health disorder is so high that people will not own up. So that's one thing to understand. There's stigma also in the United States around this, but it's not as burdensome as it is here. The way we adapt it here, we want to make sure that the questionnaire that we use actually incorporates some of the cultural nuances around anxiety. So an example would be, do you have palpitation often when you think about normal things? A lot of folks do not know what palpitations is, right? You're going to have to break that down because English is not the first language or primary language for most people. So what does that mean in a different language? How do you begin to express that in a different language? The questionnaire that we use, finally, we test it in people without symptoms or signs, and we test them in a primary care setting. Well, over here, if we're going to test that questionnaire, we have to be sure that the same questionnaire may have the same accuracy. So that's how we begin to think about adopting this. The World Health Organization, the good news is that WHO actually has, I believe most of the studies in depression actually came out of Ghana. Is how you culturally appropriate those questionnaires for folks who to use them.
And I think that's, from the clinical perspective, how do we adapt it to make sure it fits the population? From the society scope, I think what this guideline is also trying to tell us, at least I see as a Ghanaian to think about, is that what aspects of our culture is maybe hiding the fact that there's anxiety within the community, right? Mm-hmm. Appreciating that anxiety, we have different versions. You have socialized anxiety, right? You have generalized anxiety disorder. There's so many aspects or different types of anxiety, I should say. And so what the guidelines are telling us is that society in Ghana, how are we going to make sure that we're accounting for how mental health, particularly anxiety, looks in our communities, right? I'll give you an example, just a little bit here. This afternoon, Dr. Odegebge and I went to a cancer, it's called Safe Haven Cancer Society. And you all should go check it out if you haven't. It's founded by Madam Janet. I can't remember her last name now, I apologize. But it's essentially offering resources, right, to help take care of women that have had breast cancer. She's a co-founder, she's also a former breast cancer survivor. Now, one of the women when we were there was talking about how since she had it, she lost her job. Number one, family has kind of ostracized her. So she can work, and when she thinks about even the care, how is she gonna afford the care? That was bringing about anxiety, right? So you have the actual condition itself of breast cancer. that can maybe just the management thinking of it in this society, how do we find the funds to account for this big money that you usually have to show for a chronic condition like that, right? Once it happens. So that's one thing. But then the part that maybe makes the anxiety even worse is the stigma that comes with it. So she has breast cancer. People are no longer wanting to be around her for a number of reasons that are not, I would say, legitimate. And now she's become anxious, right? Or she'll be more anxious as she's engaging. So the guidelines are telling, at least I think about it often, is that we have to appreciate anxiety as it comes with illness, right? The challenges there. But then anxiety that maybe we as a society put on others because of our behaviors, right? So that's what I think this conversation is kind of pushing us towards. So we have to be mindful of.
And speaking of our society and our culture, I think for the longest time, somehow Ghanaians have been able to manage their mental health. It's like you are more or less forced to suck it up. You know, we don't talk about it much. We are going about our lives. We are going through, we might be going through the symptoms, you know, but somehow we are, I don't know what we do, but we are sort of dealing with it. But now more and more is coming out that a lot of us have mental health issues. You know, so what can we do differently this time? I don't know whether it was a good thing, how the situation was in the past, where it wasn't really talked about much. I think the only time you recognize that someone has a mental issue is when you see them on the streets, when they start running maybe naked or talking, you know. But we've come to learn that that's like the very extreme. You know, but as we go about our duties, one way or the other, we all have a certain level of mental, I don't call it disorder, but yeah, mental difficulties, you know. So there should be a healthy way of dealing with it. I don't know if my question is clear in this our setting.
Yeah.
So what can we do to make it more obvious, to make people more aware and nip it in the bud before it goes overboard?
So I think in terms of strategies to address it, what's important is that, you know, first we have to be able to differentiate, as Dr. Odegebge said before, the difference between anxiety disorder and being anxious, right? Coming on live, you know, I can get anxious, right? You know, it's a new feeling I'm not familiar with, you know, and so my heart could start racing. But if I am, let's say, if I'm going outside of my house and I start getting anxious, where to the point where even opening the door, my hand is shaking, right? So I'm sweating, all these things. That's anxiety or disorder that needs to be treated in some regard. So if you're asking what can we do about it, I think it's first identifying and knowing the difference between being anxious, which is very normal, as we said before, and having severe anxiety, or where your mannerisms in response to what people say is normal, or it's a little bit increased, right? Now, if you're on the level where, you know, you can sense that this is not helping me function, no one has to tell you, but it's a challenge for you to get on about, to go to work. Sometimes your work environment can make you, you know, can lead towards anxiety disorders, right? For some, it can be chronic, the condition. Some, it can be based on maybe your environment or time in your life, what have you. So identifying first what is happening with me, right? Knowing also what are the triggers. What is it exactly that is making me worrisome? Not just I'm anxious and my heart is racing, but worrisome to the point that I cannot proceed with day-to-day activity. So I think those kind of strategies are important for our environment as individuals. Now, like I said before, if you're somebody that has a chronic condition, it's important that as you're, you know, maybe you're new to the condition, there's a lot of things going on. Let's just say like the breast cancer case study that I gave with the Safe Haven Cancer Society, that then you need to let your provider know that I'm struggling in this area. I notice that it's not just that I'm weak from the services that I'm getting for my cancer treatment, but that I am not able to proceed. My thinking is a bit foggy. I'm worrying every day about just stepping outside of my house or somebody seeing that I've had breast cancer surgery, right? That's something that you want to take to your provider and talk about for sure. Additionally, I think it's important that anxiety, a lot of, we have variations, as I said, but it's being social in the sense of letting in people in your network that you're comfortable with, talking about it. That I struggle, on a daily basis with this to the point that I can't move and I become stiff, right? So it's a condition that you feel like you're the only one that maybe is experiencing it, nobody will understand it, but talking about it is a way to actually try and manage it. My husband is really good at saying that if you want to be a healthy person, there are 3 things you want to achieve. And I think this applies to our conversation. So definitely exercising is number 1, right? Eating healthy and taking care of yourself. Believe it or not, sleeping and resting. These are all simple things that we take for granted, but are also important for us as we talk about the different or dealing with anxiety. Now, I will highlight that there are variations of anxiety. So you want to make sure that, in some ways, when it's becoming too excessive, that you do talk to your provider about it. And I think Dr. Odegebge can shed some light on, from the provider perspective, things that you can maybe take note of to manage.
So before you go there, let me ask this question. I think you provide an answer for that. Are there people who are predisposed to anxiety disorder, or it can happen to anybody? And if they are, what are some of the risk factors that can result in the developing anxiety disorder?
So I think the question you're asking is that what are the risk factors for anxiety disorder? Are there people who are kind of predisposed? There may be a family history, but for the most part, we think that most of the studies that I've looked at, people being predisposed, they're mixed. And so the way I would put it is this: there are symptoms and signs of anxiety disorder that we need to be aware of. And if you understand those symptoms and signs from what we reviewed in the guideline with the panel, it became clear to us that in people without recognized symptoms and signs, if you screen them, then that screen is beneficial. So what are you screening for? What are the kind of symptoms that some people can have? I think the first thing to appreciate is that sleeplessness is a sign of anxiety. You get home, you're not sleeping well, and you're not sleeping well because you're ruminating. You're thinking a lot about things that you're excessively thinking about, worrying about some issue or the other. The second thing is people say they have palpitations. In other words, they're feeling their heartbeat. They are aware of their heartbeat. They're having this fast breathing. Others just feel irritated about any small thing, you just feel truly irritated, overtly irritated. So those irritations can be a problem. Some may have, some may have some signs where they're just feeling very restless. And you say, what is this restlessness about? Just can't explain. And others yet cannot even explain what's happening to them. They cannot even say what's going on with them, and they can't even understand how they can appreciate that they truly have anxiety disorder. So those are the symptoms you want to watch out for. Of course, there are others, but those are the big ones that people, watch out for. And so I would argue that rather than say you're looking for risk factors that can predispose folks to anxiety, remember, the way we define anxiety disorder is excessive worrying that has no basis. Right? Excessive worrying that has no basis. You see somebody, they look irritated to you, and people say they're feeling irritated about things. People say they're feeling worried about things. Then you need to probe them more. What are you worried about? What is that that's bothering you? Well, I just lost my job. That's anxiousness. That's normal. That's a normal reaction. You have a good job. You have a relatively good relationship. Your family is okay. You're healthy. Yet you're irritated and you're anxious. There's nothing going on at work. There's nothing bothering you. There are no family issues you have to deal with. Then that's the kind of person you begin to worry that they may have anxiety disorder.
So it's not necessarily that you're having serious challenges. Everything could be going well with you,
Yes.
but somehow you're anxious. Wow. Yeah, that must
And there's a
be
lot of people like
serious.
that.
Yeah.
We
Okay.
just don't, like as Angela said, we don't openly talk about mental health disorders, whatever the reason is, right? We just don't talk about it. I think the way we looked at the guidelines as a panel member is that we're calling action. You know, we're calling, this is a call to action, raising awareness about the importance that we need, all of us need to ask our primary care clinician that, look, can you give me a screening for anxiety disorder, just to be sure.
So how often should we do this screening?
That's a very good question. In fact, when we look at the evidence, it wasn't clear. Do you do it yearly? Do you do it? But I tell people, if you're an adult and you've not been screened, get screened. I think that's a good way to put it. Adult less than 5 years of age, get screened. People, older adults, 5 years and older, the accuracy of the tools it wasn't good enough.
Yes.
So that was the piece where, we don't know. There we tell people, they should really talk to their physician. And between the patient and the physician, they can come to a conclusion on what they want to do. The clinician can use their clinical judgment on whether or not to screen that particular person. The evidence was insufficient to recommend for or against. We did not say don't do it.
Exactly.
We don't have enough evidence for or against screening.
So I want you to tell us a bit about the United States Preventive Services Task Force and whether there's
have in Ghana, and it's but you have the Ghana College of Physicians and Surgeons that often regulates such. But that college is based on a policy for how we train our physicians in the setting. But then you often have psychological society or association, you have psychiatrists association, so they may have guidelines for Ghana. I'm not aware of those. But we don't have a national body similar to the United States Preventive Services.
I think as of late, the most that Ghana has done, and I would say, I think this is a work in progress in terms of the mental health awareness, but there's a WHO Ghana, the initiative that they have where they're trying to get more people to actually screen for and be aware of the mental health, cases out there. So there are conversations on the policy side, but it has not translated to the population. And I think that's where these kind of moments for us to amplify, what's going on perhaps behind closed doors is important. Also in Ghana, as in other countries, we're now seeing more and more people, young people at that, committing suicide. I'm not saying that every case is related to anxiety per se. It could be any other mental health challenge, but it is forcing us to talk about it and to figure out what exactly could be the triggers within our society that we need to be mindful of. So I say that to mean that even if we don't have the policymakers yet providing guidelines for Ghana, we as communities, as individuals, need to be talking about it at home. So if you're a parent, are you, being mindful of how your child is responding to certain life things, regular things? Are you talking to them about how to address mental health? If you are a husband or wife, are you sharing those conversations with each other in your day-to-day life? And, families in general, are we starting there? I think you can go even further here in our society where religion plays a huge factor. And people are readily going to their pastors and religious leaders for any and everything. Are we in a position where those leaders are equipped, right? Equipped to actually discern or know, what to see for what's happening with mental health? Are they willing to talk about that and not make it an issue of stigma, right? So I think it's leading to a lot of things. But.
Yeah. So two things come to mind from what you just said: the parenting bit and then the religion. So I was just discussing so we're actually at a training program. So I was discussing with some of the participants about parenting and how some parents, especially those who are a bit affluent, will give their kids everything when they're growing up. Everything on a silver platter. And then when they're grown up and they're not getting that same kind of treatment, or maybe their parents pass and now they have to fend for themselves, then some form of anxiety comes out of that. And then with the religious part, people are so dependent on their leaders. They have this false sense that everything should go well with me once I've given my life to Christ, or I don't know about the other religions. I can only speak for the Christian religion. But yes, so once things are not going well, then they get kind of despondent. Yeah. So what can you say about that? There's something else I want to say.
Yeah, let me make it very important to appreciate here. You raise a very important point. We need to be careful though about saying that this is just in children of people who are affluent and they give a lot to their children. Look, as a parent, that's what you want to give your kids what you have. That said, there's a check and balance. There's a way where you have to balance that.
Yeah.
Reward and effort. I think what I'm hearing you say is that there has to be a way to be able to appreciate when do you reward a child, when don't you? Anxiety disorder does not know race, ethnicity, religion, socioeconomic status, language, or wherever your continent is. It's a disorder that is biologic. In other words, it has nothing to do with really, people don't put it upon themselves. We're not born to say we're going to be an anxious person. That said, there may be some family history, there may be genetic predisposition. There are some people who have depression, who just don't. There's no other basis for their depression other than that it's a clinical disorder. So I think we want to recognize that mental health is a big problem. Now that said, yeah, there are some programs that actually allow there are theologians who actually they do counseling. There are two ways to treat. One is behavioral counseling, counsel people in a way that you can, when it comes to anxiety, our beliefs matter. You have certain beliefs that you ruminate over. They're just worrying over these things.
Yeah.
Well, the idea is to use, in a classic one, cognitive behavioral therapy. This is the work that social workers have perfected to help people shift or reframe what their beliefs are. And there are some other ways to do counseling that actually is religious that can help as well. Because now there are programs where if you look in Ghana, how many psychiatrists do you have to the population? How many psychologists for that matter? You don't have enough. And so they're beginning to train non-psychologists and non-psychiatrists to do behavioral counseling. And the clergy is a place to do that. And clergy has been around forever doing this kind of work. And then there are medications that people take for anxiety disorder. Just to be very clear, they do work, they're very beneficial, they're very effective. And so in my mind, and in my opinion, it's important to appreciate that there are different options for treatment. And you can have medical treatment on the non-medical or non-pharmacological treatment as well.
And I think I'll add that we are, to the point about parenting and you have a rich child and what have you. Again, I agree that it's not as easy to say it's just based on status. And so maybe that's why some people will be anxious. We don't know if that will lead to anxiety disorder. But why today's time it matters for us to be having this conversation is that there are parts of our society, social media controls a lot of what we do, no matter your age, race, gender, what have you, right? People are constantly going to social media for guidance. And for some people, that could lead to more anxiety, right? Doesn't mean, again, you're gonna have the actual disorder, but it can lead to make you anxious. And then who knows what could happen from there. So again, to just kind of harp that we have triggers in our world today that were not common, let's say even 30 years ago, right? Facebook was not as big. Now we have Twitter, Instagram, all these things that run our minds. So it's important for us to acknowledge that it's not just based on your status, your gender. There's so many things that can lead to you being exposed to be more anxious for one, and then maybe unfortunately going towards anxiety disorder. I also want to say that if you do have anxiety disorder and it is not a death sentence. It's not something that you have to hide from. As Dr. Odegebge said before, in the U.S., there's a forum to talk about mental health in some regard, but yet we still have challenges there. There's still suicide there. In our, in our Ghana, we're just using, where we're at for an example, we don't have a forum, right? We're not pushing ourselves to talk about these things. Imagine, as I said before about the Safe Haven Cancer Society woman, she has breast cancer, which is quite common, but there's stigma associated with that culturally that's pushing her to perhaps be more anxious. So that aside from just somebody that doesn't have that kind of condition, but yet society is leading towards that. So there are a lot of triggers that I think we need to be more open about that can lead towards anxiety disorders.
And speaking of which, talking about what was before and what is now, what I mentioned earlier about our society and the not lack of total unawareness, but mental health issues not being as prominent in the past. What came to mind is probably our family setting was sort of a contributing factor to managing our mental health, because we are very much into the extended family. So let me take a woman who's had her child, for example. I mean, we know about this postpartum depression and all that, and some of that comes out of the woman being alone and not having help, But because of the extended family system, there are some, now it's changing a bit, but in the past, you have a lot of people coming around to help you, take care of the child, cook for you, keep you company, help around the house, So I think that could be one of the reasons why it wasn't as prevalent as it is.
Well, I think the prevalence part, we really don't know because we weren't paying attention or looking for it.
Okay.
We weren't measuring exactly at any point. So to say that was it more prevalent now, it's kind of hard. And even now, we don't really, as was said with the guidelines, we don't even have all the data to justify or look at to say in older populations over 65, do we see more generalized anxiety or anxiety disorders in that group? So we don't know. The example of the woman that's given birth and has extended family, because maybe 30 years ago we didn't pay attention to it, perhaps that person was exhibiting signs, but because we didn't have these symptoms in place, because we didn't know how to look for it, we assumed that, she's just a new mother, so she's worried. That's why. But maybe she did have, anxiety disorder that was beyond the fact that she's in a new phase in her life. So we do have more resources now for us to perhaps do a better assessment of mental health conditions like anxiety, which I think is we're fortunate.
Yeah. Great. Okay, we've talked a lot, so I'm going to open the floor now for anyone who has any questions. Raise your hand or unmute yourself and ask your question. Before I allow someone, I just remembered someone sent me a comment when I sent out the flyer, and she was talking about how she dealt. First of all, she didn't know she had anxiety disorder until I think she went through something and was diagnosed. But she leaned more towards religious intervention. And what she did was, whenever she started feeling like she was getting anxious, she just goes, separates herself and prays and prays and prays until the heaviness lifts. Then she's fine. And now she's managing it really well. So, yeah. And then someone also sent a comment earlier. Where are you? She says that I had to quit my job due to anxiety disorder. I didn't know mental health issues was a serious illness until I was diagnosed with one. So indeed, people are going through it, but they're not alone. So I'm really glad that we're having this conversation, and it will help us better recognize it and deal with it. So, you want to add?
I was going to add that I truly appreciate what she said there, because I would advise every adult to actually, the next time you see your doctor, ask the question, can you screen me to see if I have anxiety disorder? it's really calling attention to the issue. I'm glad that she has the religious aspect to deal with. She has the church, spoke to our pastor. It's important. We cannot not talk about this. If you have a teenager, the evidence also shows that that's also good. Now with social media and everything and what have you, the pressure that kids have today is different than it used to be. So it's important to really take time to talk about these symptoms and signs.
Is it all primary care physicians who know how to screen for anxiety? Or
they should all be aware. The devil again, one thing we said in our panel for our recommendation is that the services, even in the US, is often not available. So we're calling attention that there are barriers to actually seeking mental health. Once someone is diagnosed and confirmed, you have to connect them to care. And so more often than not, it's difficult. So we're beginning to talk about how do you remove those barriers. So most primary care providers will know how to screen. And the World Health Organization has culturally appropriate screening tools for our region. That will be very helpful.
that's good to know.
And I think also looking at, it may not be a physician per se, it may be a counselor, a therapist that you can reach out to and to kind of learn a little bit more about or just to find out there are other people that you can go to actually help you or to maybe treat anxiety as well or other mental health conditions. So it's not just your physician that you need to go to.
Thank you. Okay, question time.
Yes, can you hear me?
Yes, we can. Go ahead.
Yeah, thank you. Thank you for having this conversation. I'm enjoying it. My question is especially focusing in the part that you are in Ghana, West Africa, where people going to church is a very big thing. And in the Christian faith, Philippians 4 talks about don't be anxious for anything. So somebody that calls themselves a Christian, if you go with this problem about anxiety, the first thing they're going to talk about is maybe you're not doing the right thing in your Christian walk or something. So how do you present this information to them without them feeling like they are losing or they are not taking their right steps in their Christian faith? Because the Christian faith is a journey, it's a life journey, that it doesn't end at some point that you are above all these things. As the good doctor stated, it goes beyond race, your status, and all that kind of stuff. So you could be someone that is fasting and praying every day, but you will still have this. And someone like that, how do you have this conversation with them so that it doesn't seem like where the Bible says be anxious for nothing, but in all things come to God with your prayers and requests, that you going to God praying, of course, we're never going to, cut that off. But there are certain symptoms that if you don't take care of it, eventually it's going to envelop that Christian life that you're trying to portray. So basically, that's my little question there.
That's a big question.
Who wants to go?
I think that how do you address the Christian aspect of having faith and then still being anxious? That's what at least I'm getting from the question, right? Or how do you approach that? So how do you deal with somebody on that? It's important. I get, we have the Bible verse that says, do not be anxious for everything, and definitely well understood. I think when we're talking about these conditions, and I want to emphasize that it is a condition, it is an illness, it can be or get to that extent. If I were in the shoes of talking to that person, I'll first ask them, let's just, before we get to the Bible verse of not being anxious for anything, tell me first, what is making you worry? Tell me how you notice that you're worrying that it's excessive. Because what we want to appreciate in the Bible, at least when I hear that verse, is that do not be anxious for nothing, right? It's comforting to know that. It doesn't mean that you're not going to be, but it's giving you guidance that you don't need to sit on that, being anxious aspect. What we're talking about is that we have to be cognizant of the fact that you could be in a more extreme version of having anxiety, right? So if I'm talking to that person, I first want to identify what is making you anxious? What are you thinking about that you feel like is worrying you? Remove the religion or the faith aspect from it, because this is like if you're talking to somebody that has hypertension, right? That we're just going to talk about what are the symptoms of it. We want them to recognize the challenges that they may have, right? The risk factors, as we call them. So that's one thing that I want to appreciate, is that let's remove the Christianity aspect from that person on a one-to-one. And then we get to them to a place where they are saying that, well, I'm actually anxious because I found out that I'm going to be fired, or I found out that I don't know, that I have a chronic condition, right? And so I've been struggling to get out of bed because of that. That at that point,
I'm not even sure why I'm anxious.
I'm not even sure why I'm anxious, right? I'm not too certain. That's a point that we can start talking about strategies that are still in the good book, right? That are still in the Bible of how we can address the anxiety possibly. So I don't know if I'm addressing the question well, but I think it's key for us to kind of extrapolate the religious aspect at first, or remove that, and just say, what are you truly feeling? What is triggering you? And then we can start talking and bringing in the faith to kind of build that person up or get them on set.
I think you're trying to say that we shouldn't over spiritualize these conditions.
It's just like you have cancer, you get cancer, right?
Yeah.
It's a health condition, right? So it's not something that is so far removed from what you can get on a daily basis. Now, when it says do not be anxious for anything, I think it's more in terms of our day-to-day, don't worry to the point where it becomes excessive. But if it gets there, it doesn't make you less Christian, is what I like to emphasize. It just means that you have maybe a health condition, right, that we need to think more about strategies to treat it.
I'll talk from the health education perspective to your question there. So what can I do? How do you message such people? I think the verse is very clear. Do not be anxious for nothing. In other words, it's putting the onus on the person not to be anxious. So if you know the reason why you're anxious is saying you need not be. The condition we're talking about is anxiety disorder. It's excessive worriness that actually interferes with your normal daily activity, over which you have no control. The people that have this disorder don't know that they're actually anxious. By the time they know, what you then want to do is, what is it that's making you anxious? That's the way I will probe it. And then if it turns out you can't find what it is, that person may have anxiety disorder. And to me, the verse, I will argue, actually calls for us to be able to screen people for this.
I mean, as you talked, that's what just came to mind, because first of all, anxiety is a normal thing. I mean, we're all anxious about things, but you need to be able to identify that you have that and deal with it. And just like the passage says, do not be anxious about anything, but in everything by prayer and petition, with thanksgiving, present your request to God, and the peace of God, which transcends all understanding, will guard your heart and your mind. That's the treatment there.
Right there.
Exactly.
So acknowledge, like somebody said, that this passage came about because they know that you will get anxious, but they're just encouraging us that when you do, this is what you should do.
What you do, exactly.
Then, so that you don't even get to that anxiety disorder. But even if it gets there, you can still rely on this,
to guide you.
To guide you.
Your thoughts and your
And you can rely on the fact that if it gets more serious, right, to that worrisome stage, that God has blessed us with resources, being physicians, counselors, what have you, if it has to be medication, to help us treat this health condition, right? So I really want to emphasize that we can't, a lot of faith, and I would say sometimes I would just highlight Christianity, will make it seem that it's something that's so not common. It's, and there's nothing that can be done. We just need to know that it's not the right way. But truthfully, unfortunately, diseases and illnesses are a part of our life, right? But God being so good has given us training in terms of people to help us treat that, in terms of other resources that we can turn to, educating ourselves to help us address that. So
Okay. Thank you so much. That was Kofi. Are there any questions, any other contributions or questions?
Good evening.
Good evening. Hi.
All right, thank you. All right, thank you. I'm Dr. Ayedu, a consultant dermatologist. I would like to appreciate the team and the Prof for this wonderful topic. It's an eye-opener, and a lot of people are suffering from this condition secretly, and they don't really know, just as Prof has highlighted. But I just want to also ask a question or maybe a clarification. Also, you mentioned, sir, that most of them are not aware that they have this condition, but when identified, the place of psychotherapy, because the issue of anxiety too, just at the question that somebody raised, also the Bible says, 1 Peter 5:8 or so, that we should cast our cares on the Lord. But they may find it so difficult to just roll away the fear or the anxiety or the worry. A place of psychotherapy, maybe in the church as well, so that since many people will go to the church, to the pastor or to the imam, those are in the other religion, and maybe they should be incorporated into since we don't have enough psychiatrists, incorporated into the treatment, and then maybe to psychotherapy to also help. I don't know. Let me ask the question if Prof can throw more light.
Yes.
I agree.
I completely agree. There's something the World Health Organization, WHO, talks about, something called MGAP. And the idea behind MGAP is mental health gap. In other words, in low-income countries, low-resource settings like Ghana, I think at one point you had 9 psychiatrists to the entire population, not about 12 years ago. Maybe it's increased. Let's even say it's 25. Let's say it's 50. Let me make it 100. 100 psychiatrists, so 35 million people. You're going to find most of them in Kumasi or in Accra or Takoradi or most of the major cities, right? When you go to a rural setting, you just don't have them. So the idea behind the MGAP is that we're going to do what they call task shifting. We're going to shift the tasks of the psychologists and of the psychiatrists to non-physician workers. In fact, I believe the evidence came out of Ghana where they looked at, this was for depression now, if I recollect, but my memory serves me right, where they trained clergy to actually do counseling for people with depressive disorders. Big deal. That's really the issue now, that because we have these services, we know that the church or the mosque is a backbone, it is a backbone of how people worship here. Then we've got to figure out a way to shift some of those tasks to the clergy, and they can then guide the counseling. The key issue to appreciate here, I think this is where it becomes very important, is there are resources that can train lay people to become counselors. And this is where the clergy comes in. So that's great question you asked, but there's evidence at least surrounding that around depression. And I would imagine that the same will be true for anxiety. So,
and this relates to tailoring it to our setting. Because we're people who are very religious.
Yeah.
So then when we take it to the places we go to the most, which is the church, the mosque, then we can get the help that we need. We don't necessarily have to always
wait to
go
see the
to
doctor, which you don't have enough.
Yes,
exactly.
You have enough churches.
Too many, actually. Anyway, that's another topic for another day. I see Moses' hand up. Please go on, Moses.
Yeah, good evening, sir. Good evening, ma'am. I really appreciate this topic that be quite inspiring. And also, just want to share a little of my experience. In recent times, I've seen majority of people are coming to my clinics.
Moses,
most of them come.
Up a bit.
Okay, I said I've seen most people coming to my clinics. Most of them are present with more or less like an anxiety disorder, but they will present as if they're having a cardiac symptom, especially present as if they have arrhythmias. But by the time we now get down to the root, since they presented to a cardiology clinic, we do initial evaluation, try to look at the ECG, do some parameters. But by the time we found that those things are normal, so we now have to interrogate them and try to look at their social life. By and large, we find that most of them are actually suffering from anxiety disorder. Even some of them, in the middle of the night, they may describe a situation that look actually like a panic attack, which is an extreme features of anxiety disorder. So it's from my own observation now, it seems to have been on increase, though there's no evidence to actually from my clinics. I found that from observation, they've been increased probably because of the current economic changes. Also, I just want to highlight when it comes to religion that currently, especially depends on denomination, my denomination is fully aware. If not for this meeting, but I mean, last Sunday, I was supposed to even give a talk on mental health among men currently. So people are aware. And when Jesus himself is talking about do not worry, that means worry. He said, do not worry severally, even before Paul said, cast on your body. I mean, before Paul also emphasized it, Peter also emphasized. That means as at that time, to this anxiety disorder has been in existence. So we don't need, and he told them that those that are aware do not need a physician. He's trying to tell them that also, you people that are having this time, you need physicians. So he says, take faith. Faith is a practical action. Try to look at this and know how to get away from it. So being religion or being working with faith does not exclude us from taking a practical step. So even some churches now are aware. They are giving different kind of health talks, mental health talks, anxiety here and there. So people are becoming aware of their status, and some people are trying to come around the hospital to seek help. So what we all need to do is to create more awareness, create more sensitization so that people will be able to know, especially those who are not within the circle where all these things are there. There are some churches they don't even have any form of health worker with them. So when they are suffering this, they may not really know. But one thing I've realized that most of them, the moment they are developing a feature of breathlessness, heaviness, so the fear of having a heart attack, they present. And by the time we look into them, we find that they may actually be solved. They are actually having a form of anxiety disorder, some features suggestive of anxiety disorder. So I think based on this, we need to increase the awareness, sensitization, so that people can actually come out and then they could get help. Thank you so much. It has been very enlightening. I'm grateful.
Thank you so much, Moses.
I want
Please,
to
I don't. Sorry. Okay. Sorry, sir.
Okay. Right.
Please go on.
Right. Thank you. I don't know whether there's still enough time. I just want to make a suggestion, if possible, that if this type of discussion can be extended, because most people that will benefit even more also will be in the general population, maybe in the on the television, on the radio, on every social media, so that many people will get to know. They will get to know this condition and go to the right place, see the right people, and they will be, they will benefit immensely from it. It's a very wonderful and very educative and presentation, and it's a good discussion. Thank you so much. Just a suggestion.
Yes. So I encourage you to go to the YouTube channel. Let me mention the name. It's called the ABBY IMANI REVEALS Show. Just type it in Google and it will come up, and subscribe and then share the link with others. I also share it on Facebook after every session. I post it on WhatsApp, I post it on Facebook, I have it on LinkedIn. So if you're on these platforms, just go there and click on the link and share it far and wide so that people can hear. As to TV and radio, it's the what do you call it? Medium to long term plan. So keep praying with us. One day we'll be on TV, so that, in fact, it's going to be global.
There you go.
Yeah, so that the whole world will benefit from our discussions. But Prof, you wanted to say something?
I want to just agree with the last speaker, I think it's Moses, talked about his patience. I should say here that about 40% of people with hypertension actually have anxiety disorder.
Okay.
And so that anxiety itself can definitely to drive blood pressure up. And sometimes people, at least in the United States, where they looked at the data, they found that most women who have symptoms of disease actually present first symptoms of anxiety. And so it's a very common disorder. It's just that people don't recognize them. And the ability to screen becomes very, very important. So raising awareness, educating the population, as the last speaker said, becomes very, very important. It behooves all of us to be disciples in actually raising that awareness so people know that this is out there.
And I think it's good to appreciate that when we're dealing with somebody that has anxiety disorder, that for you that you're not experiencing it, please do not assume that it's a fast process, that all you need to tell them is that go pray or, sleep better or eat better or exercise. To each their own, right? And so we have to appreciate and give mercy and grace to each other when we're dealing with somebody that has anxiety or any mental health issue, but that's the example we're using tonight of anxiety disorder, that the timeline for each person is different, because you have to understand that what may have caused that person to become or to have anxiety disorder is not going to be the same as another person's, right? And so if you're having a one-on-one with them, you can't say, well, this person dealt with this way, or, aren't you a person that prays often, so shouldn't you be able to, bounce back? No, it takes time. So if you're gonna take the onus on yourself to be kind to that person, just know that the timeline for them is not gonna be based on what you say, right? But I think that sensitivity issue that was raised before is really critical when we're talking one-on-one, because not everyone is going to go to a doctor or a counselor. So in our one-on-one interactions, it's important that we know how to deal, on a daily basis with somebody that may present with anxiety.
Thank you. Are there any other questions, contributions? The floor is still open. Still have some time.
Yes, this is Kofi again. I have another question. I think Dr. Odegebge talked about kids. How do you start this conversation with them so that it doesn't get to the point where it looks like they feel like you're pushing them, that they have some kind of disorder, just to normalize the conversation so you can understand, because it is right. You can't give them everything that they want. And at the same time, you cannot, take everything away from them and think that they are going to function, okay, because of the society we live in. So how do you as a parent start having this conversation with them from an early age so it becomes normal, so that when you see some signs, you are able to catch it before, it gets to the next step where, because we read a lot about, unfortunately, young kids, committing suicide and all sorts of stuff, or getting into drugs, and all because there was something that was not seen when it started,
I'm going to quote the scripture here.
Sure.
They teach a child how to behave, and I'm paraphrasing, that they won't depart in the ways. I have 3 boys. I talk about everything. You just have to talk about it. There's nothing, it's like you're asking me, how do I talk to my child? And I think there's a place for that. Teenagers are a special case. But I think you bring it up when you're having dinner, when you're having breakfast. Whenever everybody's together, I talk about things I think are important. Like, hey, this is where I talk about safe sex and all that. I just talk about it. I talk about the importance of consequences and behaviors, right? In that case. In this case, it'll be like, I'll do something like, there's something called depression, something called anxiety. And I'm sure in your school at some point or the other, you've heard of some parents of kids really committing suicide. I just want you all to know that I love you dearly. And if there are some things you want to talk about, feel free to talk about it. Some things to be aware of: if you cannot sleep well at night, you're having sleepless nights, let me know about that. Or let your mom know about that. Or let your friend or your brother or your sister know about that. If there are times that you just feel like, feeling very anxious, let's know about it. If it has nothing to do with your exams, then want to know about that. I mean, whatever it is, the sports you're playing, I think we have to make sure we're communicating with children and that they're communicating with us. And that release an innate, if you may, power and spiritual power that we have our children. we just don't utilize it enough.
Yeah, and let me add to that in terms of talking to your children, it's important, given their age. So let me just say, if you're using the example of a 3-year-old child that may not have the language to understand when their heart is racing, right? Or when they feel they don't want to go to school and they're really shaken up about it.
Yeah.
I think, for parents, it's really important to pause for a second, especially if you have a young child, to literally get them to sit, right, relax, and just do breathing exercises. It sounds really tedious, but with children that don't have language, those kind of things where you can say, you know what, let's just breathe out. Let's just breathe out. Those are lessons that you start incorporating for that child early on, to say that when you have that feeling where like, I don't want to go, or something is too much for you, just stop for a second and just start breathing, right? Because they don't know language well. They don't know how to process why they have discomfort or why something is making them scared to a different level. You understand? So I think trying to get them to process it that way, if they're young as 3 or something, right? These are things you want to start early. So don't wait for them to be teenagers and then start talking about, how do you address or how do you think about this? The beauty of good parenting is that sometimes you can discern when your child is not acting, maybe their typical self, right? So you want to make sure they open the door, like Dr. Odegebge said, that they have an open communication with you. Now, I will also say that there are some children that are able, or even adults able, to hide things well. So I think a part of parenting too is also knowing that if I keep the door open, hopefully one day my child will come to me, right? Just to maybe talk, right? But starting early and teaching them how to express themselves and how to, just pause and reflect is really, really key and important. Good question.
Great answers. Any others? Floor is still open. You can raise your hand, you can unmute and speak. Okay, so as you spoke, I thought about my own experience. And I haven't shared with any of you before. I've shared with a few people that my family knows. Now, so at the time, I was attributing it to depression. But from this, now I can tell that it was some form of anxiety disorder. So when, a few years ago, before the COVID, I felt a bit restless at work. I felt like I wasn't progressing as I thought I should, so I wasn't really motivated, to go to work. So then I decided to try and get back to school and do another master's in a different field, which is counseling. I did that. I was on the verge of going. It didn't happen. The COVID came, and with the lockdown, it was like a blessing in disguise. Because then it was like everyone else is at a standstill. So, I'm cool. I wasn't worried that I wasn't making progress. But then it ended. Life went back to, in quote, normal. And then I had to think about my life and, what I was doing, where I was going. So then my parents came down with COVID. And initially we didn't know it was COVID. But because my mom is a retired nurse, she was able to handle it pretty well. She helped my dad. But later on, we just decided that we'll go and have them tested. By the time we went, most of the symptoms had cleared. But the health center decided to detain them because of their ages and some of their underlying conditions. So then I was alone at home, so I came home, I think it was a Friday. And the next day, Saturday morning, I woke up, getting ready to go and see them. And then I started sort of, I don't know whether it's called hyperventilating or like I couldn't breathe, I was like, wow, what's going on? So I got scared that, why do I have COVID? I didn't have any other symptoms, So I called a doctor friend and he assured me, he said, no, I mean, the only time you get to that point of not being able to breathe is when you're really ill at the time. So then I calmed down, I ate, and then it passed. Fast forward a year later, it happened again, and this time it was another morning, I woke up, I was actually having my quiet time. And then I saw this rush. When the COVID came, somehow I had this serious fear. I think I had COVID fear. I don't know if there's a word for it. COVID phobia, I should say. So I woke up this morning and I saw this rush on my chest. And then suddenly I was like, because one of the signs was some weird rush somewhere or something. And just after that thought, I had that sensation again. I couldn't breathe. So I quickly rushed out. I didn't tell my parents. Rushed out, went to the hospital, went to do the test, did everything, did other tests, nothing. And then a few days later, it happened again. This time, when it did happen, it was when I had taken my phone. It was more of, I'd seen a message that got me excited. And then I had that feeling. So I went to do ECG, echo, X-ray, and everything came out negative. There was nothing.
You're not having a heart attack.
No. If Sylvia is watching this, you understand this. We'll share it with you later. So then, when you talked about breathing, so then I was asked to see a psychologist at Olugbenga, and one of the things he recommended was breathing exercise. And that was one of the things that helped me. Later on, there were other health conditions that came out, but basically, it was one of the main things that whenever I felt like I was getting into that, I'll just start breathing deep. And then I have a nurse friend. Shout out to Helena. Hopefully she's watching. So she's a nurse. So during the COVID, the breathing exercise was one of the treatments that she gave to patients and COVID patients, and it really worked for them. So then I did a lot of that, and every now and then I still do. Yeah. So I mean, these things exist. I mean, I've been through it. I've experienced this. I can appreciate all that you're saying, and I want to say that it's possible to manage, anxiety and all the strategies we've talked about, religious, medical, and you yourself, And when eventually I fell ill for some time, and people really came to encourage me, tell me stuff, But at the end of the day, I had to take it and believe it for myself, and trust that I could get out of that situation. So if you find yourself in that space, like Angela said earlier, it's not a death sentence. You can't come out of it. You just need to identify that you have this. What we say is the first step towards getting a solution to a problem is acknowledging that there's a problem. So acknowledge that you have it and seek out the various interventions and have hope, have faith that you can come out of it. So that's my testimony.
Thanks for sharing. It's powerful.
Okay, so we'll round up, but I'll allow for any final questions or comments. Anybody? Going? Why?
Yes, again,
Okay.
thank you. I just want to say thank you for having this conversation. It's been great. For the host, you might not know me, but my baby sister is sitting on your right-hand side. So these are conversations that, we have sometimes, and it is great to see her with Dr. Odegebge talking, sharing insights. And I just want to say I appreciate it. And Angela, hurry up and come back to the US. We need you back here.
I'm keeping her here.
Thanks, bro.
Thank you, Sukofi. And I asked her to thank you for me. Like, came early. You were on time. In fact, in time. God bless you so much.
Thank you all.
Someone also says, thanks so much. That's Olawale. God bless you. So yeah. All right.
Thank you all for tuning
Thank you
in.
all.
Thank you
And
so
please
much.
be an advocate, okay?
Be an advocate,
Yeah.
go test, go get screened is
Yeah.
important. For those with signs and symptoms, see a clinician,
Yep.
a psychologist, a therapist, a doctor, your pastor, your imam, seek help.
Yep.
It's important.
It's important.
Manageable, curable, treatable. Thank you.
Yes.
Josie.
Hello,
Aifah,
please,
we see
before you leave, can I say something?
Sure,
Yes,
sure.
yes.
Please go on.
Hello,
Yes, go
my
ahead.
name is Janet Brakuhiapa.
Okay.
Angela and Doc.
Oh, our line is breaking.
Oh,
Yeah.
your line is
And
great.
this afternoon, I wanted to say thank you. I'm sorry I missed most of what you said, but it's something that I think we will really need. So how can I get in touch with you to have another such conversation?
Oh, you can just reach out to me anytime, Madam Janet. It will be a pleasure. As she said, she's the co-founder for the Safe Haven Society, Cancer Society, that we just were fortunate enough to visit today. So you all should check it out. But we can definitely talk offline directly about maybe opportunities to have this discussion again.
Thank you so much.
I miss Josie
God
Aifah is
bless
my
you.
manager and handler. So
Okay. Josie is the manager.
Thank you so
Thank
much.
you very much.
Yes, thank you as well. And all the best to you and everything. Bless you for the
no,
work
for the
you're
good
doing
work.
for the Safe Haven Cancer Society. Everybody should go check it out and provide some resources. So thank you all.
I think I'm going to have you on the show.
Yes, I think that's a great
You
idea.
should.
I'll get your
That's a great
contact
idea. That's a
so
very
that
good
we have a
idea.
discussion.
Thank
here.
you.
Yes.
Thank you so much. Bye.
All right.
All
Bye,
right.
everybody. Thank you.
So this has been the ABBY Imani Reveals Show, where we speak, we're real so that we can live the abundant life that Christ has given us. So please, let's take care of our mental health so that we can enjoy life. I mean, God has given us so much to enjoy, and we need to be healthy to be able to enjoy them. So thank you. Will you pray with that?
Yes. Heavenly Father, we thank you for today. We thank you for allowing us the ability to share with you. You say where two or more are gathered in your name, there you are. We thank you for the knowledge today. Continue to guide us, bless us, lead us in your truth in Jesus' name.
Amen.
Thank you all so much. So you can unmute yourself,
Bye,
show
everyone.
your faces as you exit. Let's see you. Don't forget.
Good evening,
subscribe
good night.
to the
Bye. Thank you.
Mhm.
Thank you.
Bye.
Bye-bye.
All right, bye-bye.
Bye-bye. Thank you. Bye. Wonderful conversation. Thank you.
Bye-bye.
Bye-bye, Prof. Yeah.
Thank you. Bye bye. All right.